Hi, everyone. Steve Adubato. We welcome Gene Stennett, Vice President of Oncology Services at Holy Name, to disclose one of our healthcare underwriters. Gene, good to have you with us.
Thank you. Thanks so much for having me.
You know, the question of cancer screenings, where are we as we move forward in 2023 compared to pre-pandemic, the pre-pandemic situation in terms of who's getting screened, how often are they getting screened, and what's the problem? Loaded question, I know, with a lot of folks not getting screened.
So, I do think people are coming back to screening, but there is concern nationally that there will be an increase in later detection of cancer because people did not get screened during the pandemic. So at Holy Name, I haven't personally seen an uptick in cancer diagnosis or late stage cancer diagnosis as a result of fair screening, but people do consider that a national concern. And it may be the case. I think patients will make a decision about coming back. I think during the pandemic, we were certainly in a situation where we were treating patients both virtually and in person. And I think many organizations are actually doing the same, but I think that it still remains to be seen the impact of people not getting screened during the pandemic.
So let's go through each one of these areas. Breast cancer screenings. What is the best advice? I know everyone's different. Everyone's got a different family history, whole bunch of issues. Breast cancer screening, best advice, please.
So the first thing to do is to talk to your primary care provider and or gynecologist in the instance of breast cancer or mammography, which is typically starting at age 40, but in many cases starts much earlier, dependent on family history and sometimes genetics. But mammography is the gold standard still for detecting breast cancer. And the earlier you do it, the better. So age 40 would be the time to start. Even earlier than that is breast self-exam, which many women are encouraged to do starting at the age of 20 or beyond.
Prostate cancer.
Prostate cancer is still screened via blood test. Starting age can be between 40 and 55. Again, the most important thing is to talk to your doctor because they'll help to guide you and help you understand what your personal circumstance means that you should do in terms of getting that testing. But certainly the blood test, it's called PSA. It screens for a hormone that helps you to understand the levels of the prostate activity.
So let's do this. I disclose a whole bunch of issues, particularly who our underwriters are, but let me also disclose that I know that I'm scheduled for a colonoscopy. Hope that is valuable and is public service in some ways for those watching. What is the considered best practice when it relates to colon cancer screenings, colonoscopies?
Mm-hmm. So the guidelines now, and there are guidelines for each screening, are that some type of colon cancer screening should start at age 45. In many instances, there's also a non-invasive test, a stool test called Cologuard. The issue with Cologuard is that if it turns out to be something, you have to do the colonoscopy anyway. But again, in collaboration with your primary care physician, they'll help to guide each patient on what the best thing to do to get screened for colon cancer is, but certainly starting at age 45.
With technology changing so rapidly, Gene, are there, quote, home tests for any of this?
Cologuard is actually a test that you do at home.
Oh, it is?
Yes, it's a stool test, and you mail it in to the company that runs the test, but you still have to go to your doctor to get the packet or have the packet shipped to you.
You know, it's so interesting as I'm listening to you, Gene. It strikes me that healthcare professional, public health expert like yourself, you're here with us trying to provide valuable, important information about people's health, protecting themselves and their loved ones. But the larger question from my perspective that I struggle with is how many people don't trust the, quote, public health infrastructure? And I don't know if that means government, people in government engaged in public health, whether it's private hospitals like yours and others. To what degree do you believe that public health and medical advice has become so politicized for so many that it's hard to just give, hey, this is what the science tells us, please?
I have to admit that I think people have a responsibility to take care of themselves, right? And so regardless of where society leads you, regardless of what society makes you think, your responsibility is to yourself. And that means engaging in the right things to keep yourself healthy. And screening for cancer is one of those things, for sure. And while I'm willing to accept and admit that sometimes societal factors impact those decisions, I still think people need to be in touch with themselves and make the best decisions for themselves, the best decisions for their families, and look more internally for the guidance on that, and attach to a position that you trust that can help you to make the most appropriate decisions.
It's interesting you talk about trust a physician, but you told our producers about a multidisciplinary team approach if in fact you're diagnosed with cancer. Explain that in a way that folks can relate to and understand, please.
It's really the best way that cancer care is practiced now. And in many ways, I wouldn't necessarily say it's innovative, but it is the best way. A multidisciplinary approach brings all of the providers together to collaborate, to consider the personal and medical factors of each individual to make the best decisions on the right course of treatment, right? So in cancer care, there's medical oncology, radiation oncology, and surgical oncology. And if those team of physicians are getting together to decide what's best for the patient, it's much easier and much more appropriate and likely to have a better outcome for the patient in deciding what's the appropriate course of action for them. That's the gold standard, I'd say.
Just to be clear, language matters. Providers, when you say providers, do you mean physicians?
Yes, physicians and sometimes advanced practice providers are part of those teams. But honestly, in considering all of the health-related factors, there are social workers, there are nurses, a lot of players in the equation that all get together in these multidisciplinary teams to help decide what's best for the patient to do.
By the way, I want to just give a shout out here and acknowledge that in 2022, you were recognized by ROI, our media partners, ROI influencer, women in business, top women in business who have the most influence. And when they say business, that's one thing, but healthcare, to be more specific. Gina, I want to thank you for joining us.
Thank you. Thank you, too. Thanks for having me.
You got it. Stay with us. We'll be right back.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by the Turrell Fund, supporting Reimagine Childcare. PNC Foundation, the Port Authority of New York and New Jersey, Newark Board of Education, NJ Best, Delta Dental of New Jersey, NJM Insurance Group, New Brunswick Development Corporation, and by Veolia. Promotional support provided by NJ Biz, and by CIANJ and Commerce Magazine.
NJM Insurance Group has been serving New Jersey businesses for over a century. As part of the Garden State, we help companies keep their vehicles on the road, employees on the job, and projects on track. Working to protect employees from illness and injury, to keep goods and services moving across the state. We're proud to be part of New Jersey. NJM, we've got New Jersey covered.